Good day, dear colleagues. Good day, dear doctors, students. Hello, my name is Apokin Alexander. I'm a dentist. I'm working in Moscow, Russia. We continue on our surgery day today. Our previous case report about wisdom tooth extraction, and now I want to present you also very fresh today. Also, we can name it 0-day implantology. The case of implantation in fully edentulous mandible, two implants. In future, we plan to fix the full removable denture of the lower jaw, fix it with the ball fixator and these two implants. The next day before, we made conical beam computer tomography for this patient in our dental practice. Discuss this study and plan to insert two implants in position of lower canines, upper and left. Okay. Now let's discuss this case with the clinical video. Let's start. We open the mouth to our patient, made infiltration anesthesia from the left and right side of the lower jaw. The blade 15 to made very small short incisions through the all layers of the gingiva to periosseum. With this very small elevator for gingival papillars, we open this very short incision, check that we reach to the cortical bone, and then we plan to make a pilot drilling in these two areas. Today we're using Osstem implants. I like it very much. I work with them some years, and it's very good production, very good logical and quality implant system. Today we also use a very fresh video without any cut process, without pre-processing. This is just from camera. And now we choose the pilot drill. We touch the cortical bone, find the ridge of the bone, and start the drilling. Not very deep, some about 7 millimeter, maybe 8 millimeter, just for position. It's very thin bone, but as the reasons of the biological costs of this operation for my patient, I decide to make very small incisions to reduce the after surgery problems with the traumatic inflammation for this patient. That's why I carefully drill cortical bone, by placing parallel pins, or maybe also it may be called parallel guides. The second drill is 2 mm diameter. The 13 13 mm length. In this case, I think this is the bicortical placement of implant, because we have very deep drilling, and this is my plan. Yes, because very small amount of bone in this area, in this mental area, very huge atrophy process in the all alveolar ridge of the mandible. The second drilling only for cortical pilot drill. The second drilling 2 mm diameter for the full length of this drill. This is very simple protocol, but this drill must be worked on with the skeletal bone, but today we have also soft mucosa. I know that, and the last drilling I made more than length of implant. I checking the depth with the depth probe. The last drilling 2 and 5 mm in diameter, and then finally I insert the implant 3 mm diameter. Much deeper drilling. This is enough for bone level placement of implant. Good. We're checking also every time for paralleling with parallel guides. The other implant side also drilled with this last diameter drill, 2 and 5 mm on the full deep, also for bone level placement of implant in the mental area. Very small bleeding, very small incisions. This is very atraumatic implantation. For the whole patient group, I think this is the best choice. This is the sterile implant Osstem in this capsule. Here it is, the cover. Now we're ready for insertion this implant. 13 mm long. The mount system. The next moment I decide to replace this is very long machine implant instrument. This is not useful, and I decide to insert with the shorter one. This one is shorter. It's more useful for me in this situation. And we start to insert. During this work, I work in the position of 12 hour. Machine insertion, the upper limit is 30 Newton per centimeter. The second implant. In this implantation system is very useful. When you insert this machine mounting part of implant at the level of this wide stopper at this implant, you in totally cases receive bone level implant insertion under the soft tissues. This side I have reached the 13 Newton centimeters, and then I decide to insert implant with the hand insertion, not machine made. But this dynamometric K also show to me the straight near physiologic amount, 30 newtons. Good. This is the holder to avoid the movement of fresh implant insertion. We remove all screw from implant, and then we're ready to remove all these mounters from implants and insert the covers. I remove only one and then insert the cover in implant from this package. Нет, секунду. Да, записываю. After this screw is finished, we also remove the next mounter and also cover implant with the screw. Here it is. The next stage, we need to close these incisions. I'm checking the position of implants. It is bone level. I'm using the standard hygienic sterile probe. We use the standard suture technique. 5-0 needle and separate suture. Total time for this operation is 20 minutes. We wait for about 2 months, make control radiographic image intraoral, and then place gingiva formers and make impressions. All other stages also will be documented on this video protocol, and if you're interested, you can view this continuum stages of this case on our YouTube channel. Please follow us, search us in other social nets like Instagram, Twitter. The next month we'll start to publish additional materials to our library in the different fields of dentistry: implantology, therapy, endodontics, prosthetics, and also surgery. We try to make a better video quality every day for you. Thank you for your attention. Please leave your comments, questions. This is very important for us. Thank you very much. Goodbye.